So Yolanda Foster, she's been talking about how she had her breast implants leaking. She mentioned that they were toxic to her body. So toxic or not toxic? What's the story with Yolanda's breast implants?
So Yolanda had silicone breast implants done several years ago. It's hard to know exactly when, but the issue is she also has Lyme disease. So here are these two things now that are kind of confounding one another. So she felt that the Lyme disease was actually getting worsened by the fact that she had the silicone breast implant rupture. Right. So for those of you who have silicone breast implants, don't freak out. Rupture is pretty much a low percentage chance of happening.
How common is it for a breast implant to leak?
The average is about 10 to 15%, and that's a little bit different, saline versus silicone, but on average for both, 10 to 15% leakage rate. When it comes to Yolanda specifically, I'm assuming she had imaging, so either an MRI or an ultrasound. So when she had her annual breast exam, this was possibly found on that exam. So
that can show you if your breast is leaking.
If it's a large leak, yes. If it's a smaller leak, maybe not. And that's why I think a lot of patients are now kind of concerned about that specifically, because there's a subtle leak that's happening. You might not even notice it. Right. And it might not be picked up on imaging.
Could you have a leak that's been going on for several years and not know it?
You absolutely could. When it comes to saline, it's a little bit less likely to not know it, because saline, obviously, it's a bag of salt water. So if that collapses, it's pretty obvious. And so even a small leak is a little bit more obvious when it comes to a saline implant. Right. When it comes to silicone, because it's a harder substance or a little bit thicker, that's a little bit harder of a thing to kind of show either on imaging or clinically. Sure. But I will say, and this is something that we'll get to in another segment when we talk about Lyme disease.
Right.
But with her silicone breast implants leaking, there has been a lot of controversy in relation to her Lyme disease, and her saying that her Lyme disease symptoms actually got worse.
Right. And it's very confusing, because she's mentioning that these silicone implants are leaking, and that toxicity is actually what may have translated to her Lyme disease symptoms getting worse, or even been the cause.
Right.
And we really know medically that that's not the case, that there's no connection between having an implant leak and developing Lyme disease.
Right. But some studies show that in patients who have silicone breast implants, there's a higher rate of rheumatoid arthritis and other connective tissue diseases. Right. Again, small population, hard to say definitely. Yes. And those patients who had a rupture and they removed the implants, their symptoms of that specific disease actually got better. So hard to say yes or no, but again, it's there, the data is there, so it's kind of hard to ignore it, and especially with Yolanda, I think.
And it's also important to note that the symptoms of rheumatoid arthritis and these autoimmune connective tissue disorders are very similar to the presentation of Lyme. So there's a lot of blurred lines there that we can't really say exactly what was going on in her. We do know that she's feeling a lot better since taking it out, so I think there was some toxicity maybe that was building up that did at least help her out. So I think she made a good decision by doing that.
So ladies, and even some men, if you're having any issues with your breast implants, please let your doctor know and make sure that there isn't a leak. And now, as we said, there might be just kind of small leaks that aren't picked up on imaging, but your doctor will be able to pick that up even if it's a subtle small implant. So you don't have to sit there and wonder and be concerned, am I having a leak or not?
Right. And there may be something else going on also that the doctor could help you with. Mm-hmm. So any discomfort, questions, absolutely reach out to your doctor. It's a great first point of contact. And questions about Lyme disease, we've got that coming up next for you. We want to make sure everyone understands the difference between Lyme disease and implants, because they're not related.